Okay, continuing on a few thoughts after the American Migraine Foundation Migraine and Cognition webinar, which I invite you to watch the recording on YouTube. There are also conditions that are more common in people with migraine that can also affect cognitive function. So we need to address those such as depression, anxiety, ADHD, sleep disorders such as obstructive sleep apnea, insomnia, traumatic brain injury, dysautonomia such as POTS. There's a lot of other conditions, right? Like long COVID, cancer, myalgic encephalomyelitis. And then there's also the role of hormone and in brain dysfunction. About 50% of women were in the perimenopausal transition experience cognitive symptoms such as issues with verbal memory, processing speed, attention, brain fog, and migraine is associated with more severe vasomotor symptoms, which are themselves associated with sleep disruption and lower scores in terms of verbal memory. So migraine or cognitive dysfunction are not indication for systemic menopausal hormone therapy, but improvement in cognitive function is one of the indirect benefits of menopausal hormone therapy. So we cannot ignore the symptoms in the perimenopausal transition. Then endometriosis, to 80% of women with endometriosis experience cognitive dysfunction, usually worse before and during the menses, oftentimes in terms of memory, attention, executive function. So we like to work with our OB/GYN colleagues to really help manage, as endometriosis is also more commonly seen in women with migraine.